We have we had the only post-traumatic stress disorder and mandatory traumatic brain injury testing of our National Guard program. Minnesota just last week, using our model, has now announced that they too, based on what we did in Illinois, will be screening 100% of their National Guardsmen for traumatic brain injury. That TBI PTSD program initially is going to cost about $10 million to start. And that cost, depending on how ill some of these vets are, and whether or not the VA will take care of them, which they should, but if they don't, we're not going to let somebody with a brain injury sit for 2 years. Our legislators in Illinois, and by the way, a bipartisan group of legislators sat down with me and said, "What do we need to do something." And I had a room, it was amazing, I had a room with 20 legislators from both sides of the aisle saying, "We have to do something, what are we going to do?" And so along with the governor, we came up with this program. So we're going to pay for that out of the budget of the state of Illinois for a war that was a decision made at the federal level. I don't think that the states were really consulted, but those costs are being shifted to us. We have a wonderful mortgage loan program where we're the only state in the country doing it. Again, we started off with $15 million. We're offering $350,000 mortgages to our veterans. That's the Illinois Department of Housing Authority, IDHA. Basically, 20% of the mortgage is 0% interest. 80% is at a very low interest rate. They are required to have mandatory financial counseling, and we give them a grant for the closing costs. We went through $15 million in 8 weeks. We were given another $15 million. We went through that second $15 million in 6 weeks, and we're on to our third $15 million. This program would not be as wildly successful as it is if there was not a desperate need amongst our veterans of that age group, those young guys coming home, the 20 to 40-year-olds of that age group. It wouldn't be successful if there wasn't a desperate need for accessible housing for these veterans. I just think it's ironic that the people who fought and were willing to lay down their lives for other people to pursue the American dreams are the ones who are having some of the toughest time accessing the American dreams for themselves and their family members. Housing is such a big issue now that on any night of the week in Illinois, 23% of the homeless are veterans. So tonight when you go to bed, 23% of the homeless out there in the cold tonight are veterans. That's better than the national number, which is 25%, but it's still not an acceptable number. They're being driven to homelessness. Some of them are Vietnam veterans who've been homeless a long time, but more and more young vets are being driven to homelessness because of undiagnosed, untreated post-traumatic stress disorder, traumatic brain injuries, and also just a lack of reintegration. Young veterans coming home today, unlike previous eras, are home within 24 hours of when they get, they get to Kuwait. They leave, as we say, come into the wire, and they're home. They're back here, and they're expected to leave everything that they've been doing to survive and to help themselves and their buddies survive in a war zone behind in the space of 24 hours. It's simply not realistic. So a lot of them are having major problems with coping issues, and we're starting to see a rise in homelessness, which is why we started our first homeless program here in Illinois, the Prince Homeless Program for disabled veterans, just started 2 weeks ago. Again, there's another program, another $2 million that the state of Illinois is going to pay for partially. We're getting ready to look at building a new veterans home in the Chicagoland area. There's $15 million in Illinois' budget, the upcoming capital budget for another veterans home in the Chicagoland area, desperately needed. But that's a cost of the war in Vietnam that we're still paying for. The Harvard University in the beginning of this year came out with a study that estimates that over the lifetime of the individual, this country will be paying, I just want to make sure I get this right. They're estimating anywhere from $350 to $700 billion in the healthcare costs for those 1.4 million veterans who've come home from Iraq and Afghanistan. That's a significant cost that we will be taking care of for a long time. And you can expect that some of those costs will be shifted to the states for many of our states' social services, whether it's health insurance, whether it's they end up homeless, whether they end up incarcerated in our criminal justice system. And so this is a real crisis in policy as we're moving forward, because we haven't really thought about this in those terms. The states are sort of coming together piecemeal. We in Illinois are very lucky, but we have a great coalition in terms of support for veterans that the state is doing quite a lot. But it shouldn't be a piecemeal issue. A veteran's access to health care, housing, employment should not be dependent on his geographic location. Should not be based on the fact that he happens to live in Illinois, which is a state that is doing its best to take care of our veterans. But if he lives in Rhode Island, he's literally out in the cold. The other aspect of that is because the VA was so unprepared and they have such a huge backlog, they have a system of identifying how disabled you are that is a very subjective system. It is actually regionally based. So that I have a friend that I call my amputee twin, or my ampu twin. He and I recovered together at Walter Reed within 2 weeks of each other. We have almost exactly the same injuries. We had almost exactly the same operations within 2 weeks of each other. Almost exactly the same equipment. Discharged from Walter Reed within 2 weeks of each other. He lives in Texas, I live in Illinois. The federal VA's region in Illinois considers me less disabled than the federal VA region in Texas, which says that he is more disabled than I am. Now, that's not as big a deal for me because I have employment, I'm able to support myself, my husband is working. But for a 20-year-old veteran, his access to health care and his access to disability compensation, his ability to take care of his children and his family depends on that VA disability rating. And sometimes a difference of 10% can mean the world.